Hi everyone and welcome to On the Move. This is Brandis Montgomery. I'm a doctor of physical therapy. I'm the owner and physical therapist for On the Move Massage and Physical Therapy here in Metro Atlanta. And today I come to you with some information about debunking the myth that physical therapy does not work. At least once a month, I would say even more than that, I hear from a patient, I've had physical therapy before and it didn't work. And I'm here to say that there are a number of underlying reasons as to why that probably was the case. There is numerous research articles out there stating how physical therapy, especially hands-on physical therapy, guided exercise and instruction can be beneficial. Most of the research shows greater than 75% success when using physical therapy as opposed to other forms of conservative treatment as well as non-conservative treatment like surgery. And so if you had an unsuccessful physical therapy session, we'll call it, then I am here to help you have some ideas as to why and what physical therapy can and should look like for you. There is hope, and I want you to know that you need to just find the right fit out there and find the person that is going to help you seek your goals and is there to help you get better, not just to collect a paycheck. So the first reason that people give me as to why physical therapy hasn't helped them is they'll say, I went to all these physical therapy sessions and I quit going because I can do those things at home. I don't need to go to the clinic to do the exercises that they were giving me. And that is very valid. However, if you feel like that is the case, a couple of things could be going on. Your physical therapist is not progressing you like they should. If things are easy and you are mastering them quickly, that is not what you need to get better. You're already good at those things. You already have efficiency there. You already have strength there, whatever it might be. So the first thing I would say to you is you're not being progressed. You're not being assessed on a regular basis enough to know that what you're doing is no longer helpful. You need to have, as I tell my patients, a moderate challenge. If something's not moderately difficult as you're doing it, you're probably at that mastery level and you don't need to be doing that exercise anymore, or we need to progress it to something that's a little bit more challenging to your body. And the other reason for this could be that you are doing your exercises incorrectly. So you think you can do them at home, but 90+% of patients, at least for the first few sessions, do their exercises incorrectly. Or they just don't know what muscles to activate while they're doing the exercise. So you don't want to just go through the motion. There's a reason why you're doing the exercise. There's a reason why your PT thinks, this person's lacking mobility here. This person is lacking strength, flexibility, whatever it might be that's limiting you and causing your pain or your deficits. And so there's the reason behind the exercise needs to take place every single time you do it. If it's a posture cue that your physical therapist needs to be giving you, then you need to make sure when you are not in the clinic that you are also doing that cue. A very common one that I give people is when we're talking about shoulder or postural upright posture, is to not let your shoulder blades go up as we squeeze them together, but making sure we're squeezing our shoulder blades down and in. This is where a lot of our shoulders tend to stay, but we want our shoulders to be down and back. That way we're opening up our chest and we're recruiting bigger muscles in our back to help us. So a lot of times I'll show people an exercise. They've had it as a home exercise for a week, 2 weeks, 3 weeks. And when they come to the clinic, they're still doing it incorrectly. They're still recruiting upper trap and bringing those shoulders elevated. Or their shoulder blades are tipping forward as they're doing it instead of squeezing back and open. Just an example for you. But those are the types of things that you want your physical therapist to be going over with you when you're there. And if they're not, then again, I could see how physical therapy isn't helping you. If you're doing things in the wrong technique, wrong form, not utilizing the muscles that you need to be using, you're not really making any changes there. So make sure that your physical therapist is helping you in the direction that you need to go and making sure that they're challenging you. And the next reason why people tell me that physical therapy didn't help them is that their physical therapist didn't seem to understand the movements that they need to do. So an example would be, this is probably the most common one that I see, a physical therapist that is not athletic or has never played a sport, or at least has never played your sport or doesn't know what you need to do in your sport. If I'm a volleyball player and I go to a physical therapist that's never been an athlete, or they've never played volleyball, they've never played anything remotely close to volleyball, they may not know what muscles I need to use as well. They may not know what motions I need to take while I'm on the court and what motions could be causing me pain. So you need to find a physical therapist that is on your level, let's say. There's nothing wrong with the fact that some people just don't know the sport or they don't know sports in general. However, if that's what you're trying to get back to and that's your goal, I recommend you finding a physical therapist that knows what you do and what you need to do so that they can help you meet that goal. And I will personally say that's the things that I enjoy the most, is working with athletic individuals and helping them get back to sports. Not only understanding the movements of the body and what sports need to return to the sport, but also the mindset that it takes an athlete to get there. It can be very frustrating. It can be painful. It can be time consuming. It takes a lot of dedication to get back to a sport sometimes, but that's what you need, and you need a physical therapist that can help you alongside both of those things. And another reason that you may not have gotten what you need out of physical therapy or feel like it failed you is there is nothing wrong with going in network. There's nothing wrong with going to a physical therapy clinic to be seen. However, I will tell you that more than likely you will be one of many patients being seen at the same time. And the reason for that is when we go in network, companies, in order for them to make money, need to bill a lot more than, say, a cash-based one-on-one physical therapist would to make money. So in order to do that, they're going to see numerous patients at the same time, so that when they get reimbursed by the insurance company, they're making, let's say, what I would make with one patient. So it's easier to have overhead. It's easier to take care of all your bills and pay all the things and live when insurance companies aren't taking a big chunk of what you're billing. So I say all that to say, when you go to a clinic, when you're going in network, you may be one of 2, 3, 4 patients being seen at the same time by the same physical therapist. And what that might look like to you is that you're being ignored, or that you're not getting the attention or the one-on-one care, no hands-on physical therapy when you're there. I know personally, working in clinics, I still do some clinic work. When I'm there and I'm trying to see 3, 4 patients at one time, it is very difficult. And trying to make sure that I give everybody a little bit of attention and help them maybe gain one little thing each session is usually my goal. I want to get my hands on them to help them discover one new motion, one new muscle to contract, one new postural cue, whatever it might be, to help them progress between now and their next visit so that they have something to work on when they're not with me. But you will find physical therapists that take this as an opportunity to give you exercises. Maybe you're working with a technician, one of the aides, or maybe you're doing these exercises on your own because they're trying to work with several individuals at the same time. So it can look like you're being ignored. It can look like all I'm doing is going and doing these exercises, and that's not helpful, understandably. So make sure that your physical therapist knows you need some attention. It's okay to say that. It's okay to ask questions. It's okay to ask if they'll guide you through a motion or guide you through an exercise. That way you feel better about the technique or what it is that they're trying to address with you. And the last reason why people oftentimes are not seeing progress and not getting success with their physical therapy is physical therapy is a team effort. I can't say it enough. For all the people in the back, physical therapy is a team effort. Physical therapy does not mean I'm going to go to my physical therapist, they're going to massage me, it's going to feel so great, I get all this individual one-on-one time, and then I go home and I just am cured, and now here's life and I feel great. Physical therapy involves the physical therapist getting their hands on you, it involves the physical therapist guiding you and directing you, and it involves you doing that thing, whatever the physical therapist is helping you with, on a regular basis to train your body to see results. We have to change patterns, habits that have been there for who knows how long. And in order to make any of those changes happen, you have to do your part. So it is not one-sided. It is not supposed to be a feel-good, just going to get my massage today. It is a progressive, very intense, time-consuming dedicated process. Let me say it again. It is a very time-consuming, dedicated process. Team effort has to happen. If you feel like you don't want to put forth that effort to do it and you're looking for a quick fix, physical therapy is not for you, and it's not going to help you. You're not going to see results. You have to do your part. And that's why we should get away from the pain pills, the injections, the surgeries, this idea of I want to feel better yesterday, when your pain could have taken years and months or who knows how long to come about, and now you're wanting fixed yesterday. So keep that in mind. It takes time, it takes dedication, and it takes teamwork to get you where you want to be. If you feel like you are one of the people that have failed physical therapy in the past, maybe you feel like you did not have a great example of what physical therapy should be to you, then you need to let me know so that we can work together, or if I can find someone in your area to help you work together with, that I feel confident knowing they'll take good care of you. Find the clinic. If it has to be a clinic, I can give you recommendations of places that I know will give you good care. But you cannot also sit there and say they didn't do their part if you're not doing your part. So keep it in mind. Know that you have to work hard. Physical therapy is a high success conservative treatment, and in order to see that success, you just have to have teamwork and work together towards your goals. So reach out if you need help, or if you need someone to come see you. We can do virtual sessions. I can find somebody in your area if you're not nearby, whatever it might take, so that you can have a good success story of physical therapy moving forward. Have a great day.